hyperextended it. And for 14 months, have had pain. I went to two chiropractors. I also did physical therapy for 2 months, and it really hasn't been getting much better. But after 3 days, I noticed something popped and it's feeling a lot better. Like, I mean, there's just very little pain left at all, and functionality is complete. So that was huge for me. Also, I wanted to have high performance with some athletic stuff that I do with my dogs, and my knee, which I fell and injured um, a year and a half ago. I don't have any pain. I tore some tendons and stuff on it, and it's flexing much better. Like I can actually get on the bed and kneel down and all the stuff that was too stiff before. And after 6 days, just like walking the dogs up hills and down hills, my whole body feels like it's tingling. Like in the morning, I do the Celergize and all that, and all the way down to my toes, I feel like I have this tingling all over. Like everything's coming alive, and I don't get tired. I don't get run down. I'm 70 years old, and it was starting to become a problem. But this is so amazing. Like I'm just, thrilled, and I can't wait. I wanted the water machine, so I became a brand partner, and I'm on the wait list.
Hey, good job.
Yeah,
Mark, you're having that's amazing results you're having.
I know. I couldn't
I
believe
think the
how
water machine's
fast.
going to boost you even more. That's great. Look forward to you getting the machine and hearing from it, your results.
Yeah.
Fantastic. Annette,
Hi, can you see me?
no.
I know, right? I'm not sure what happened to my phone. That's okay. You don't need to see me, you just need to hear. Because okay, so I've been on LifeWave now, using LifeWave now for 3 years, and so many things have changed. But the reason I wanted to get on the call today was this hat protocol. Because I know I've mentioned that I have the ringing in my head, and I'll sometimes in the middle of the night, like last night was one of those nights. It was like 3 in the morning, and then there's like this, it's pounding and pounding, and the sound is something else. Um, and it doesn't seem like there's anything that can be done from what so far from what I've checked out. Anyways, I get up, I get the hat on, and I will tell you within 15 minutes, while the sound may not be gone, the pressure and the pounding is gone. That hat protocol, I cannot say enough good things about it. Because I mean, all the patches are wonderful, but this particular issue that I'm faced with, the hat is like a godsend.
Oh, that's beautiful.
Yeah, yeah. So,
Thanks for sharing that. It's
all right,
good.
you're welcome. Thank you.
Lynn,
So I have my 3 shares for tonight, and I'm super excited about them. So a couple weeks ago, I was at CPAC covering the event with the Patriots Prayer Network as part of the media. A lot of truthers and influencers there on our team. And I patched several of them who were having horrific pain in various places, some for years. And they had such great relief that they've been sharing it with others, which is, I love what we do. So I had the privilege this past week, someone that I patched that he shared with a friend, and the gentleman's in Tennessee, and he has had nonstop shoulder pain for 2 years. And the doctors have given up. They do all the tests, they don't see anything wrong, so they can't figure out how to treat it, and he just suffers all the time. And he heard from his friend that I patched at CPAC, how much pain relief, complete pain relief that Viking had. So he bought the patches from me, Jeff did, Viking's friend. And last week, I had him on the phone when he got the patches. And I said, okay, what's your pain before we start patching? First, I said, drink a couple of glasses of water. And so he did that. And I said, okay, what's your pain level? And he goes, well, it's an 8 or 9. And I said, put one X39 in the point of pain. And he did. And I said, what's your pain? He goes, well, it's down a notch. And just kind of, thought about that. I said, okay, put another one on your next worst point of pain. So he did, and it was a different place on his shoulder. And then he got really quiet. And I said, what's your pain level now? And he said, it's only a 3 or 4. And I said, okay, well, that's not good enough. Let's take a third X39, put it on your next worst point of pain, and tell me how you feel. And this all happened 1 minute after the next minute after the next minute. And he put the third patch on and he went total silent on the phone. And he said, my pain's completely gone. And
Mm.
I wish I could have seen his face, because I love watching people's faces as the pain melts from their face. And then you see their bodies, they start straightening up, and their eyes, they're in shock and disbelief and hope. And, that's what we say this often. We don't offer patches, we offer hope. And so he remains pain-free. This was several days ago. And so, of course, he has several friends with this chronic pain in whatever place. And with our technology, we truly don't diagnose, treat, or cure anything. We don't need a diagnosis, and our bodies just take care of the rest. So that was amazing. And then I had something very similar happen to one of the wives. Of course, we don't share diagnoses, and I won't, but she's had horrible back pain since 2013. And so the symptoms, I researched the symptoms so I could share that. If she would sit or bend or lift or twist, her back pain, which was perpetual, became even much worse. So, I try to imagine that. Who can live like that? With that, no matter what, you can't sit, you can't, and then anytime she would go from standing to sitting, it increased pressure on her back. So just horrible pain. Her husband, because I had patched him with 3 of the X39s for our pain relief protocol with that. And he put one on her worst point of pain. And shortly afterward, the pain was completely gone with just one. So she didn't even need multiple ones. And she was just totally thrilled.
Mm.
Yeah, totally thrilled. And then I had shared my third share with Jen and Roxanne earlier, but I've had one since come in. And so I just want to share, because the third one is very similar. People who are getting phenomenal pain relief. But I had a brand partner she's just a beautiful soul. She actually wrote a poem about me and the patches and LifeWave that I sent to some of you, a few days ago. But she's very creative and in how she expresses her love of LifeWave. And she said that she had a big, deep wrinkle across her neck, which I know a lot of men and women can relate to. And she said she wasn't even paying attention to it. She has all of the patches. She's worn them for probably 6 months. And she said she looked in the mirror one day, this was the past week, and she said that she said that wrinkle is almost non-existent, which, in our healthcare system, they say there's nothing you can do about that these things don't go away. But she's completely fine. And she described the results of LifeWave like an Easter egg hunt. She's so creative. She said that, you just never do know where you're going to find what. But whatever you find, it's always a surprise. And the second reason I wanted to share that was, this is her creativity. So the X2O, mine came today too. I've been so busy helping everybody, haven't had a chance to set it up. But she said as soon as she saw the X2O, she texted me and she goes, Lynn, she said, that's hugs and kisses times two. And it is, right? XO. I love it. Anyway, I had to
I
share
love
that.
the
I
way
just
she
thought,
thinks. I love it. Yeah, she's very creative. Beautiful.
I know, very creative. So I just had to share. Yep. There you go.
Love it.
Yep.
Thanks, Lynn.
You're welcome.
Tina.
H2O has arrived.
Yay.
It is set up, and I was talking to Jen, or I texted her, and I said, is it okay to try the water? She said, probably not a good idea. Well, I didn't listen. Does that mean I'm going to be up all night tonight?
Uh, you should be okay. But
I
what
don't, small glass.
yeah, small glass should be good.
It is pure heaven.
It is, isn't it?
That's all I can say.
Yep.
I think Roxanne was talking about the difference in the flavors of water, and I said, I'm just going to take this. I drink distilled water, and I even took that, and this trumps that. It's unbelievable. It's just pure heaven. So, my mother, one sec, Mom. My mother is going to be 92 in a couple weeks, and I think I've said in the past that we started June of 24, and every December she had kidney function testing, blood work. And she had a filtration rate that was 46, which I guess they consider stage 3 kidney disease, whatever.
Oh, wow.
And so I understand that at that age, 60 is considered normal. So 1 year later, December 25, she's 60.
Ooh, good.
So now she doesn't have to go back and have any kidney function appointments going forward.
Yay.
So for those that I know with elderly, I always walk a very fine line because, or just being cautious because of her age, and she's my mother. But these patches have changed my world in so many ways. Stress, accidents, weight loss. She was 174. She's down like 138. The only thing that we're dealing with is some memory stuff. So I'm very hopeful on the water machine to see how that changes things. And I gave her a half a glass tonight, too. So on that, I do have a 33-year-old nephew that had some eye issues, ended up going to eye doctor, ended up in the emergency room with a mass on his brain.
Oh,
So this exceeded the size of a golf ball.
ooh.
So today would be 2 weeks from the surgery. I said to him, I'm going to send you the patches. You have to get on these patches. I
Mhm.
said, there's nothing else that's going to help you healing. Look at what your grandmother's been through. I said, I could tell you a billion stories. So I sent them. And of course, he's in a acute rehab now. He got discharged after 1 week after that surgery, which I think is amazing.
Yeah.
And he's in the acute. And I said, ask him if you can use the patches. And they said, no. And I said, well, I want you to do me. We're going to put the patch. It's going to be on your shirt tag because he can do that while he's doing therapy. So that's what they've been doing. So it'll be interesting to see what happens there. So unfortunately, people don't believe stuff until they see results from other people. And I said, if a 92-year-old can heal, that has to tell you all you need to know. You need to get on the patches.
Absolutely.
So one quick story, not even a story, but to add to that, when he came out of the ICU, of course, I've talked to him about the patches. I've showed him the videos when he's been here, and he got out of ICU, and my brother was there, and his new wife was there talking to my brother. He opened up his eyes and he said to his dad, Auntie Tina's gonna heal me with the patches. And I said, oh, don't be saying stuff like that. I'm gonna get in big trouble. And then he just put his head back and went back to sleep. I said, that's God talking. I thought
No
it was great.
kidding. No
Yeah.
kidding. Good. Yeah, I relive it.
So we'll be looking forward to hopefully some good healing stories.
Yeah,
And,
I hope so too. Thanks, Tina.
okay, take care.
You too. Jen.
Okay, couple quickies that were coming to me while we were talking. And Jason McPherson, Michael, you and I talked about Jason today,
Mhm.
and he came to us long ago with someone in hospice that was actually dying in the hospital at this point.
Yeah.
But he called and asked me, and I called Robin because I didn't know this was brand new when we were just starting out. She says, just put an X39 on him, and he was dying of kidney failure, the person. And Jason's from a very big church in New Jersey. So the prayers and the X39 put on his kidney. Guess what? The guy turned around. He then left the hospital and he was in last stages. I did hospice 40 years as a therapist. Last stages, the patch went on. I'm not saying it does anything, but you know what? It was pretty exciting, Michael. And we were all excited about that one. And prayer works too. I'm positive. So that's one thing. The other thing that came to me, people are talking about pain. And I I was talking to Michael and Tracy Joe today, and all of a sudden my leg gave me a big cramp. I took my X39 off, put it on my leg, and boom. Because David teaches that pain is from blocked energy. And I don't know why I had blocked energy on that leg, but I took it off, put it on, and it stopped. And then I put it back up afterwards. But, so I want to teach this. I want everybody to know you can move the patches. You don't have to keep them in one spot. They can go all over. And I like the idea of it, putting a patch on a tag and a shirt. That was excellent. And then
Excellent.
the water. Okay. I just I want to say, I hope, Tina, you're ready to play cards with your mother tonight, because if you started drinking it at the end of the day the first time, Michael probably doesn't bother him. But I'm just saying, you might want to pull out the cards because it can wake you up quite a bit. So the other thing about the water that I learned last week, and it blew my mind, is David created the purification process to get rid of all plastics in our water, because I gather, I learned this week, that we are eating or consuming from the food we eat or breathing in from the air and all this stuff that's in the air, about the equivalent of a charge card a day of plastics in our body.
Wow.
So the water gets, yeah, I learned that this week. So the water process, the purification gets rid of all plastics, but then putting it in my body, it's also processing it out of my body. And that excites me because that means I'm purifying. And you'll notice if you do drink two glasses and you're starting out, oh, I'll have two, maybe three, you might go to the bathroom a bit. So what that says to me is that it can process it. I drink a glass in the morning, nothing in it. And then after a couple hours later, I'll put the Cellular in it, and that's my second glass. Other people on this show, including Michael, drink a lot more, and that's fine. That's wonderful. But that's what I do, and I do know that it's getting the plastics out of me too, and I'm ecstatic about that. And that's it. So thank you for letting me talk.
Thanks, Jen. Terry.
Hi again. I wanted to share this story that happened to me when I was at the summit. And I met this lady. She happened to be staying at the same hotel as me. And the speakers were going and she had a table there and she was like, I was just talking to her and I said, "Oh, did you get your patch today?" Because everybody, they were patching everybody. And she goes, "No, I don't need it." And I'm like, "Okay." And I knew she was older. And I looked at her kind of puzzled and I said, "Do you know what these do?" And she goes, "Quite frankly, no." And so I proceeded to explain exactly how they work. And I showed it to her and say, "Look, nothing goes in your body." And she looked at me and she goes, "Terry, you're the first person to convince me to try this." And I said, "Because all these years she's turned it down, turned it down." And I said, "Yeah." I says, "You might as well. I'm giving it to you." So she tried it. I saw her the rest of the day. She packed up, helped her friend and everything. And I go, "How you feel?" She goes, "I feel good." She goes, and she had all this energy. And long story short, she was telling me about this machine she had, and she was going to show it to me. So I stopped by her hotel that night to see what she was going to show me. And we were talking, and I walked in there. She had this dog, the really small dog. It had a cone around its neck. And I thought, "Oh," and it growled. And she goes, "Yeah, it bites." And I went, "Okay." So we're sitting there conversing, and I was there for about an hour, and this dog would just growl for no reason. And she proceeded to tell me since 2018, it was a dog that was on the streets. It was over vaccinated because they didn't know if they had vax. She felt it had neurological damage. In the middle of the night, she proceeded to say it would attack her, draw blood. I gave her all the credit in the world for nurturing this dog the way she did. And she can't leave it with anybody. And she's been dealing with it in 2018. So I'm sitting there, I'm like, wow, she has her hands full. And so I said to her, I said, "You know what?" I says, "Here," I says, "put this Eon on your dog tonight."
Yeah, good.
And she goes, "Well, what is that going to do?" Because she was kind of a skeptical thing about it, even though she felt it. And I said, "I don't know, but I said, I do know it's going to lower the inflammation and probably balance out the nervous system and do other things that it's known to do." And she goes, I said, "Just try it." And so she did. Then all of a sudden, the dog just had a lower growl. And then I left the room and I said, "Oh, by the way, that patch I gave you," I said, "stick it on your dog in the morning." And so she goes, "Really?" I go, "Yeah." So next thing I woke up before we were going about to leave, and I see on my phone, "Terry, I need to buy those patches before you leave and to get me home." And I'm like, "Okay." And so I went down there and I sold her some samples, and she was like, "I gotta wait to get home." So she got home and she goes, "I don't know." Well, first of all, when I gave her the patches, when I walked in, the dog was actually wagging its tail and was happy.
Wow.
It was like a totally different dog. I'm like, "Oh my gosh." So when she got home, she goes, I don't know what to do. It's like he has energy. He wants to go outside and walk like a normal dog. The
Wow.
growling had gone, at first it went down to 50%, and now it's hardly growling. And she's just astonished. She goes, you know how long I've been trying with these vets to help this dog? So, long story short, she's buying the patches. She's not ready to use them on her, but they're strictly for her dog.
That's beautiful.
Yeah.
Fantastic. Good job, Terry.
Yeah. Thanks.
Patrick.
Yeah, I wanted to throw something in. Well, I'm always amazed to hear the amazing stories on this. So I'm still processing all that right at the moment. But I do Qigong meditation. I've done that for 20 years. And I know what it feels like to get to a certain point in that as I'm doing the meditation, it's kind of a sinking feeling where I feel the depth of the meditation happen. But what I'm experiencing now is with the LifeWave patches, I do feel like I get to a deeper place sooner in my meditations. And I just wanted to throw that out there in case people who do meditate already want to notice that or try it. Or if you don't meditate currently, you might want to try combining it with LifeWave, because I think there is a mutual effect.
Very good. And we saw from Terry's story about the dog, that dog went into a meditative state pretty soon. That's pretty nice. The animals don't lie. Thanks, Patrick.
Yeah.
Nita.
Okay, so I'm loving these stories. They're great. I'm about to introduce this to an amputee, and she had multiple surgeries. She didn't really have a big accident. She, damaged something on her knee during a sports event, and somehow things got worse and worse and worse. The leg swelled up, and doctors did 5 surgeries and so on and so forth, didn't get any better. And the last doctor said, there's nothing more I can do for you. So after a long back and forth, with herself, she decided she's sick of all that pain, and she would have it removed, her leg. And so I just wonder, if I had, for example, reached her before all of that. I mean, I didn't know her yet, but just hypothetically, if I'd reached her before all of that, I mean, I wonder if it would have taken a different turn, after all these stories I'm hearing. So she was excited to know about it because of her energy levels, because she's a very energetic person, quite sporty too, and so on. But getting kind of up there in age. So yeah, we'll see.
Yeah, I mean, she definitely benefit from them now as well. So
yeah, because she says she has phantom pain,
yeah,
things like that. Mm-hmm.
So the Eon and the 39 might help that.
Mm-hmm. Okay.
Try. Yep.
Great.
Great, Anita. Yeah, and that's what all of us, over time, you're going to start to think, well, this could, like, Terry's story, you'll just, hey, maybe this work on the dog, and it does, and so you're starting to connect with the energy of the patches and how it works, and then you can, help people out with it. So it's very comforting to know that you've helped somebody out once you've introduced them to the patch and they get relief, or they get more energy or better sleep, whatever. So yeah, constantly be looking at how you can help with the patches. That's great. Sally.
Hi, Michael, and thank you for letting me share. I wasn't going to, I'm prompted by Anita's share about the amputee. Over many years, I went to a lot of healing type weekends and weeks. And apart from my own experiences, I got to meet a lot of very interesting people and their stories. And I remember a guy who was in the room, and he had an amputation below the knee. And in his healing session, he had his hands up where his leg used to be. And so I sort of learnt, I suppose, that even though you cut the part off, you don't cut away the field that informed the part. So I believe these patches work in very special ways on our field and our light, which comes from source. So I think if you ever have the chance to help someone with an amputation or a limb that is not healing, then definitely get those patches on. But I just wanted to report on my partner Nick and I. We've been out this morning for a coffee at a local cafe, and we've been on the patches for 20 months, I think. And so sitting at that cafe, I sort of, remembered back 2 years ago when I was able to leave Nick for a few moments. I'd go up there and have a coffee and a little time to myself, because I hadn't been able to leave him alone for a moment.
Wow.
And how life has changed for us. And we had a lovely time there. The sun was shining, and Nick drove us there, and now he's gone off to meet friends at another social event. And I'm just so grateful for these patches. And we take the performance bundle, X39 and 49 daily, and we use the other patches, in the evenings and now and again. So now it's exciting to hear about the water machine. But I said to Nick, last year I was hearing about the Celogize and getting all excited about that, because we don't get that here yet.
Oh.
And neither will we be getting the water machine for a while. But we're very, very happy with the 39 and 49 and the others. So just wanted to thank you all.
Yeah, that's great, Sally. And thanks for the insights on energy fields and stuff. It's really good.
Thank you.
Thank you. Anita.
There we go. Hi, everybody. I'm super glad to be here today. And that's why I had to share that I had a wipeout session in my storage unit today. And I'm scaling down and moving on and all that with my journey. And it easily could have been disastrous, truly disastrous. I'm thanking God for David, because had I not had a solid year of 3949 Alavita Eon Celergize in my system, who knows? Because I'm like 5'5" and I had 180 pounds forcefully coming down with weight, because it was a trip and fall onto concrete. And the wrist took it, my muscles took it. Nothing hurts, nothing is bruised. The fact that I've had the energy to scale a 10 by 30 down to a 10 by 15 on a deadline. Yes, some of it comes from lifting anesthetized bodies for a living for 45 years, almost 67. And that's a one factor. Genetics is another. I got to give it to LifeWave that I'm not in such, it was incredible to me as an OR nurse for that long. I know how crunched I should have been, so just standing in huge gratitude for all of it.
Fantastic. Yeah, that's a great share. And another reason why, we tell everybody, to stay on the patches, because, it's going to strengthen you and make you, it's going to be better for you to, if you do get an injury, you'll recover faster. And normally when you would be injured, like you're talking about, Anita, you're not going to be, because you've built up resistance, you've strengthened your body, you've de-aged your body. No. So it definitely makes a difference over time. So thanks for your share.
It is one thing that was a factor. I got to be super honest, as an OR nurse for nearly half a century, I was wearing clogs with the strap in the wrong direction. And like many people who saw me on my call weekends doing silly stuff in flip-flops, you know, it is what it is. But I'm super grateful that I came through it okay.
Yeah, so am I. Great share. Thank you, Nita.
Thanks.
All right, everyone. Great, great shares tonight. We're starting to get the trickle of the water machines in, so we're going to get some really good shares with the water machine going forward. So, looking forward to that. Lots of love to you guys. If you want to unmute and say good night.
All right. Good night,
Good night,
everyone.
everybody.